Hi, I'm Dr. Dennis Linslink, Care Coordinator and Clinic Administrator at AdvaCare Clinics in Bloomington, Minnesota. If you're watching this video, you probably have some questions about why your neck or back is hurting, and you probably were in some sort of accident, sports injury, car accident, something that caused a potential flexion extension to your neck at some point in time, and now you're having problems. In this segment, which is about 3 minutes long, please pay attention to what's being shown to you. It's actually a process called digital motion x-ray. It's center radiography. It's actually a video of an x-ray of a neck that's been injured. And it's the best way to show the damage that you sustained in a mild to moderate car accident or whiplash injury. Most people think they've never been hurt. They want to go out and get an MRI. Actually, an x-ray is much cheaper and much more clinically effective at showing what your injuries are. In our facility, a certified outpatient rehab center, we actually do in-point stress x-rays which show the same or similar information. If somebody's taking an x-ray on you laying down, forget it. It's not going to show a darn thing. What your body does laying down on a table has no comparison to what you do when you're standing upright. It's a waste of time and money actually for you, and the clinical results are very poor. You at least have to have x-rays taken in weight-bearing, standing up. Then you want to put the neck through a series of range of motions, flexion, extension, side bending, rotation. This will show us the endpoint, much like the digital motion does, of where your neck is now ending up at and what's going on in the process. It's one of the best things for court evidence as well. So please watch this x-ray video to see how your neck could have been affected in the accident that you had. It's very informative, and if you have any further questions, please feel free to give me a call. I'll be happy to explain to you or do a consultation for you to check you out to see what your injuries may be. Thank you.
The human body is a vertical structure and is designed to absorb the force of gravity in daily life. Because of its design, it can handle moderate amounts of axial compression without difficulty. X-acceleration, however, is not handled as well by the body and results in what is known as shear forces. Even moderate shear forces can result in injury. Some scientists noticed upon examining occupant test data that the peak X acceleration happened to occur at nearly the exact same moment as the peak Z acceleration. This is another graph from the same occupant test data we saw earlier. This was a crash test conducted at just 5 miles per hour. As we can see here, the peak axial acceleration or compressive force reaches about 15 Gs of acceleration, while the peak X acceleration or shear force reaches about 9 Gs at nearly the same moment. These scientists decided to investigate what effect this combined compression and shear had on the spine. But instead of simply observing the external motions of the occupant, they decided to measure what happened to the individual joints of the neck. To study this, a group of Japanese researchers subjected some test subjects to a low-speed whiplash impact, but photographed these tests using cineoradiography, a technique that makes an X-ray movie at very high speeds. This technology allowed the scientists to observe the motion of each vertebrae in the spine in slow motion. What they found was that rear-end collisions resulted in spinal motion that was far more complicated than the normal movement of the spine, and that this abnormal motion could account for the chronic pain seen in some low-speed whiplash patients. To understand how injury can occur in low-speed collisions, we first need to understand normal spinal motion. This is video fluoroscopy footage that shows the normal motion of the neck. As we see during normal flexion and extension, each vertebra contributes to the overall movement of the neck, resulting in a smooth, regular curving of the spine. This smooth motion of the spine is made possible by the facet joints on each individual vertebra. As you can see, the facet joints are angled backwards. During normal spinal movement, these facets glide across one another, allowing the spine a wide range of motion backwards and forwards. Up until 1996, researchers assumed that the spine moved the same way during a rear-end collision as it did in everyday activities. This simple whiplash motion was seen as normal position before the impact, extension backwards, rebound motion forwards, and then back to normal. The newer research, however, showed a completely different motion. First, the head and neck start in the normal position. As we saw earlier in our description of the occupant motion during a collision, the occupant's torso is moved forward first while the head stays in place because of inertia. This difference in the motion between the torso and the head results in a very rapid straightening of the cervical spine. As the torso continues to move forward, the head's inertia keeps it level and fixed in space. This results in a slight degree of flexion in the upper spine, with dramatic extension focused on just a few intervertebral joints in the lower spine. The researchers found that the spine formed an abnormal S-shaped curve at this point during the whiplash impact. Then, as the torso continues to move forward, the head finally extends backwards, resulting in normal extension of the spine. The head then begins to rebound forward. Now, let's compare the two motions of the spine. First, the normal extension. Now, the abnormal S-shaped curve.